Welcome to another episode of You Can't Handle the Tooth. This is Dr. J, the real Floss Boss, coming at you live with another episode. We've been off the air for just a little bit. We've had a couple of busy weeks, and of course we had the holidays before, but Happy New Year to everyone out there. I really hope you set some good goals, you write them down, you share it with a friend so they'll hold you accountable, and positivity, all the positivity in your life every day. Surround yourself with that. It's very, very important. So, today's topic is, what if you lose your crown? Now, I know a lot of younger people don't have any crowns. We've done episodes before on what dental crowns are, so that's not really what's covered in here. But if you've ever had enough of your tooth broken down, decayed or broken, root canal or something, and you need a crown, and you've got a crown, and sometimes they can come off. So sometimes people think, oh, crowns will last forever, right? I don't need to do anything else. Already, they'll come in, they'll have decay under a crown or something else. And I'm like, I don't understand. I got a crown. Well, a crown doesn't shield you or make you immune from any, negative things that can happen to a tooth. It just protects the tooth and hopefully prolong the life of that tooth so you can have it for at least another decade or so. And be able to function and smile and not have to worry about it. But they're still susceptible to decay, susceptible to needing a root canal or a root fracture or some other things. But in the event that you happen to be out with your friends, eating some dinner at a great restaurant, and then suddenly you feel something crunchy in your mouth, and you have had a crown or an onlay or a filling or something like that that has come out, what do you do? Now, I don't know if most of you know this, but most dentists, they kind of close at like 5. And a lot of them aren't even open on Fridays, and definitely not on the weekends. I mean, if you have a true dental emergency, it is kind of hard to find a dentist on holidays and on the weekends. So if you have an emergency, of course, sometimes you have to hit the ER and see if they can hook you up. But if you have a crown that has come off, what do you do? So a couple of things. I got this call just the other day, and I thought, I get this call enough that I'm going to make a little video about it. I said, hey, what's up? And they said, I just had a crown that came off, and I was wondering if you can help me. So my first question is always this: are you in pain? Because if you're in pain, that changes things, right? There are only certain criteria that qualify a situation as an emergency. And, severe pain can be one of those descriptions or qualifications. So, are you in any pain? Okay, so let's just say you are. If you're in pain, then you probably need to get in sooner than later, right? I mean, how you can't brush your teeth, you can't drink, it's hard to eat, it's miserable sitting around, so you want to get seen. And then the dentist can have you in hopefully that day and get things either patched up, get a temporary on, or if you're lucky enough to have a dentist that does same-day crowns, get a new crown done in that at the same time if something's broken. But if it's come off and you're in pain, same thing, it can get re-cemented on. But if you're not in pain, which is most of the time, a crown comes off, it's uncomfortable, you feel really awkward, but you're wondering, okay, what do I do? I'm not hurting, but I definitely want to make sure that I get seen and this gets treated. Well, a lot of times patients will hope that the old crown can be reused and get re-cemented, okay? So the first thing that I would do if you have a crown that comes off is I would look inside of the crown. It should be hollow. If it's not hollow, if the crown is filled with material, whether it's dental enamel or cement or something else, if it's filled with something, it is likely that above the gum is not much tooth structure. And if that's the case, then we're looking at something very serious where you're probably going to lose the tooth and have to have an implant or a bridge or something like that. If the crown has come off and there's nothing in there, it looks hollow, and you look in there and you say, oh yeah, there's still a good bit of tooth structure in there, okay, then you're in business, okay, then you got something to work with. An immediate fix, you can go to any CVS or Walgreens, any type of pharmacy, and you'll be able to find a temporary dental cement. I think that's even what it's labeled as, temporary dental cement. You buy this stuff, it's kind of pasty, kind of like toothpaste, maybe a little thicker than toothpaste. But you take it and you'll kind of mash it down into the crown, and then you'll dry off your tooth as best you can with a little square of tissue. dry it off really good, and then place that on there. And as you can imagine, if you were to put something like toothpaste inside of there and you push down and secure it down, you bite down, tap, 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 get it nice and secure, some of that excess toothpaste is going to express out onto the gums. And so you just use a little more tissue and you just kind of clean that off, and then you follow the instructions on making sure you have the best chance of that temporary cement sticking, okay? That is what you do immediately to try to get things fixed. If you can't get to the dentist immediately, either because your schedule is crazy or your dentist's schedule is crazy. So that's what you do for a temp fix. But what does it mean? Is the crown going to be savable or not going to be savable? Well, it's hard to tell unless you come in. Most of the time, the dentist is going to want to get an x-ray because on the x-ray, you can see if there's any decay. You don't want to cement an old crown on top of a tooth that has decay on it, because that decay is going to continue to spread and you're for sure going to end up needing a root canal or lose the tooth down the road. And nobody wants that. So let's let the dentist do their proper diagnosis, do the tests that they need to do. If there's any radiology that needs to be done, let them do that so that they can tell you, yes, this tooth is sound, good integrity. The crown is sound, good integrity. It still fits really good. I think it's a good chance we can cement this back in and you can get several more years out of it. Different cements will require different things. So some of the cements bond immediately and you can leave the office and you can go and eat like normal. Other times the cement requires a setting period of anywhere between 2 hours and 24 hours before you can start eating again or eating on that tooth again. So listen closely to the instructions that are given, again, so you maximize the lifespan of the crown. But not only is the dentist looking at the tooth to make sure everything's intact, if there is decay, then it's likely that once that gets cleaned up and rebuilt up, the old crown won't fit anymore and you may need a new crown. If the tooth looks pretty good, maybe it's ugly because there's some dried cement, old cement that's on there, the dentist can usually clean that up really good and the tooth's ready to go. Now the other thing the dentist will make an assessment on is the actual crown. Is it in good shape? Did some of it chip off or break? Is it going to last you? And the dentist will tell you that stuff. Hey, I can re-cement this on, but you're probably going to want to look at getting this crown replaced. It has seen its better days, right? It's got a few miles on it. And so they can tell you, hey, you're going to need a new crown, or let's put this on and see if you can't get a few more years out of it, and we'll keep close eyes on it at each of your hygiene checks. So those are the kind of things you'll expect. The other thing that can happen is part of the crown can break. So sometimes we have a crown that's porcelain and metal. So there's a metal base and there's porcelain on top. If some of that porcelain breaks and you can see the metal, it's ugly. It's not very pretty. It's not white and look like a tooth. But in a lot of cases, it's just aesthetic. So the porcelain is chipped off, but the integrity of the crown, the seal of the crown is still great. And then it becomes, when are you ready? Whenever you're ready to get the crown replaced, then you should replace it. If you don't treat it, the rest of the porcelain will eventually start chipping off. And if you ever do start chewing on the tooth, on the metal of the tooth, you can end up chewing a little hole in that metal over time. And then decay can get up underneath there. So having porcelain broken off of a porcelain fused to metal may not be as urgent to fix, but it is still something that you're going to want to fix. All right, the other type of crown is all porcelain. So we talked about the porcelain fused to metal. What if it's all porcelain and part of that breaks? So then, it could be sharp on your tongue, and that may need to be buffed or polished or something that can be done. There should be a way that a dentist can temporarily get you out of relief so that you can then schedule to have a new crown. Because if an all porcelain crown is broken, there's really no options except for to cut it all off and make you a new one. All right? So that is it. If you've lost your crown, this is what you would do. This is what you can expect. And if you have any questions about this, please don't hesitate to put it in the comments section below. I appreciate all the comments I get. I get people reach out to me on Instagram a lot, and I'm very, very excited to be able to provide this service for you guys so I can coach you, whichever dentist you're going to. This is just information for you. So good luck to you. This is Dr. J, the Real Floss Boss, signing off. We will see you next week.